Welcome to The Untold. I hope you guys are ready for a special edition of The Untold, a more medical edition, and we are also joined by my special guest host, Saad Al-Azmi.
Thank you so much. It's a pleasure to be with you here in The Untold.
Yes, Abdullah is on break right now, so I'm very happy to have you with us. You were once a guest with us as well.
Yes.
How does it feel being a presenter again?
It feels normal, actually, to be a presenter, but I'm happy to be here to take part. Yeah.
Today we have Dr. Khaleel Mohammad, who's a surgeon, which is a very difficult job. So I'm really curious to see what he has to say about the truth of a surgeon's life.
Yes, actually, the untold story of a surgeon must be exciting, of course. And through this interview with Dr. Khaleel, we will learn more about how to be a surgeon, about the medical field, and everything from studying to the profession itself, actually.
I agree. I only know about surgeons and doctors through TV shows, so I'm curious to see if that actually portrays the reality of what actually goes on in a doctor's life.
This is the chance for us to know Dr. Khaleel and for the viewers to know about surgeons and doctors.
Yes, and with that, we are going to go on a short break and be with Dr. Khaleel in a moment. And we're back from that short break. We're joined by Dr. Khaleel Mohammad. Dr. Khaleel, welcome to the show.
Thank you very much. Thanks for having me.
It's wonderful to have you. So could you tell us about when you first went to med school? How was that like?
Well, you take me back quite a long time ago. I would say it was a little bit overwhelming.
I can imagine. Yeah,
back in the day, I mean, you basically go into the unknown. Okay, you want to become a doctor. You finish high school, and then there's university, and just a totally different pathway. I think, overwhelming would be a good word to describe it, and mostly because we in that time lacked more information about the university. What is it like to study at university? What is med school? So you just, jump in and then you see what happens next. What made it easier for me actually was that my sister is also a doctor and we went to med school together.
Oh, that's so nice.
Yeah, AziadiQ8 University. So that made life a lot better. And I'm blessed to have that opportunity, to be honest. So we were like helping each other out, and it was a really good experience, to be honest.
So your sister is also a surgeon?
She is an internal medicine specialist, and now she's specialized in hematology, which is blood diseases. So she's subspecialized hematologist.
I think the surgeons are the highest risk jobs in the health sector, because my question is, since you are the first in your family to be a surgeon, tell me about your first day in anatomy class. How was it?
So anatomy, we started studying anatomy the second half of the second year of med school. It was, I would say, an exciting part, okay? We're not used to seeing cadavers, okay, dissecting them, learning. It was only in books, okay, and all of a sudden they take you to anatomy class, and they shift the study method, okay, into dissection and understanding. Very exciting. Initially, you get that feeling that you don't know how to deal with, the cadaver, but later on, when you go to the lab a couple of times, it becomes much easier, much more exciting. And then we spent at least a year and a half, okay, taking anatomy classes. So very exciting, very informative. It just takes you to the next level in med school, to be honest.
Honestly, that's crazy. The only experience I have with dissecting anything was way back in biology school.
Yeah.
And we spoke behind the scenes. We went to the same school, which is also crazy. I don't know if you did it when you were back in school. You had to dissect a sheep eye, I think, or a cow eye.
It was a mouse back in my day, but
I think they realized no mice for these snowflakes, you could say. All I know is I remember doing that, and it was so fascinating. But dealing with an entire human body is a whole different experience. I don't think I could handle that.
Well, I mean, in med school, what we do with med students is, expose them, okay, bit by bit. So you see this, knowledge coming to you, okay, step by step, and then you just get used to it. And by later on in med school, you enter, clinical work, and it becomes second nature, as you know.
Yes, yeah. I think me and my colleague Jane, we studied literature.
Yeah, very different.
Yeah. To talk about operations, especially the first one, if you tell me about the stress, the amount of stress that you faced, the first one, because I know that you must have a story about the first one.
Yeah, so, I would say after you finish anatomy classes, you study all the basic medicine, okay? Then towards the last 3 years of med school, 7 years, okay? So the last 3 years of med school, you start now studying in the hospital. You go and you rotate through different specialties. So initially you study a little bit, or you go and rotate through medicine, through surgery. But I remember towards the end of 7th year, final year, I wanted really to specialize in medicine, okay? Until, you know, one day I go into the OR and there was this emergency case. It was a life or death situation, okay? Where this patient came in and he had a bleeding aorta. Aorta is the largest vessel in your body. So he had the diseased aorta, okay, that ruptured, and they had to take him. And I was in that case, you know, as a medical student, you don't have a big role, okay, during that time. There were like 5 different surgeons trying to save him, but just being in the middle, okay, of this adrenaline rush and being in the middle of the excitement with the professor just changes the whole view of how you look at surgery. I think I spent like 5 hours in that surgery with that team, but after that, it's like, I want to do what they're doing one day. So then you start, you know, studying more and more, okay, and finding a residency program, okay, in order to do that stuff later. So yeah, it was a turning point for me, to be honest. That one surgery that happened in the last, so it was a good experience, to be honest.
Wow, 5 years in such a high-paced, stressful environment. I'm not sure I could handle that personally. I like my more relaxed environments, you could say. But speaking of how that was your turning point, did you ever have any other moment where it was like, maybe this isn't for me, where you doubted it?
Good point. I mean, you know, med school, from the moment you start med school, you take 7 years to graduate as a doctor, okay? And then later on, you have to specialize. For surgery, it's another 5 years of intense training.
That will train so long.
It's very long. It's very long. So, and then after that, okay, you can choose a specialty, and it takes you from 1 to 3 years to subspecialize in a small specialty of surgery. So you see, for instance, for me, I spent about 17 years from graduating high school until I became a fully qualified, certified surgeon where I can operate on my own. And I came back to my country to serve. 17 years. And what I remember is my mentor back in the States would always say, this is a marathon. It's not a sprint. It's not a race. It's a marathon. You really have to endure all the years, okay? Back to your question, whether there were moments upset. Of course, everyone has their moments of, I had, you know, a dozen of them. But I remember once, okay, after graduating from med school, you spend a year doing internship, what we call is, again, rotate through the first year after graduating. You go and you do a little bit of internal medicine, a little bit of gynecology, a little bit of surgery. When I finished that, I wanted to do surgery, but I went through some, you know, personal situations and I wasn't feeling good. And, you know, I felt like this is too much for me. And, you know, untold story, I decided to switch to internal medicine, leave surgery because of that stress that was there, because of, you know, a lot of factors. And I remember walking to my chief of surgery and in Kuwait here and knocking on the door 3 times, 3 different occasions, okay, just to tell him, listen, I think this is not for me. I'm early in my career. I want to switch to medicine.
Why do you think that you need to change? Is it the
it's the pressure, okay, because you know, because of the social, okay, and the second thing is because the social, you know, instability that I personally was going through, okay, affected my work. So I thought maybe by switching, maybe that would help. Now here's the thing, I went to that chief of surgery 3 times. And every time I knock on the door, there was someone sitting there, okay, with an interview. It's like, okay, I'll come back later. And then things got better, forgot about it. And I started, okay, wait, if you just give it a little bit of time, it gets better. And it really got better for me. And then I applied and I went to the States to study and it was history. But, you know, you do get your weak moments because it's such a long time. But I always tell my students and residents, be resilient, okay? This is temporary. It's going to get better at the end.
Wow, 17 years you said.
Yep.
That's so different than what we experienced, isn't it?
Actually 17 years. I'm not trying to expose your age or anything, but tell me about why it took 17 years to become a surgeon.
Good question. So you study medicine for at least 7 years, okay?
Okay.
So I graduated from Kuwait University. It's 7 years here. And then you have to work, okay, as an intern in the Ministry of Health for a year, okay? And then you basically get assigned to a specialty in a hospital. For me, it was surgery. And for instance, it was Adan Hospital, one of the Ministry of Health's hospitals. Then you basically have to do your extensive examination in order to join the specialty that you want. I wanted to go to the States, so there were extensive tests that I had to take called the USMLEs, okay? So you have to pass them, get a good grade. That takes time. It takes about 2 years at least, okay? 1 to 2 years to complete certification. And then you apply, you get accepted. Now that's first part. The second part is actually traveling there. Residency takes 5 years of training. And then subspecialization takes anywhere from 1 to 2 years. And that's why it takes about 17 years.
That's why you have high salaries, right?
Yeah, supposedly. I don't know if it's worth the job that we do and the stress, but yeah. But yeah, it's
worth it.
Yeah, it's definitely worth it at the end. Okay, initially it's very tiring. You go through the ups and downs, but it's definitely worth it at the end when you see the satisfaction that you get from doing your job. Priceless.
So what made you decide to be a surgeon in the first place or study medicine?
So medicine, initially I wanted to study dentistry actually.
Oh, okay.
Hello, oh my God, we're gonna
so many twists and turns happening.
Exactly. So initially it was because I knew, my cousin was a dentist. I sort of understood dentistry. It's easier to understand dentistry.
Yes.
We go to dentists as kids.
Yes.
Okay. We get exposed to dentists, but medicine is that hidden part that not a lot of people see. But after I went through, I got accepted to med school. The first year, you're still allowed to choose whether you want to study dentistry or medicine. After the end of the first year, you make your choice. So then I got exposed to medicine. It's like, hey, this is better. This is better for me. Okay, dentists are amazing. They're great, but medicine, reflects me a little bit better. And after med school, I really just liked how surgery was, how you do the operations, how people come in desperate need, and you can do a procedure that either saves their life or makes their life a little bit better. So I found myself in that specialty, and and I pursued it.
Yes, I think someone who says like, I want to be a surgeon, especially after graduating high school, it's special, right? Because no one can just say, I want to be a surgeon. It's really normal to say, I want to be a dentist. I want to be a lawyer. So what do you say to the youngsters that they are just finishing high school? How to choose this path?
So the first thing I tell them, keep an open mind, okay? And read about, all the specialties. If you're interested in medicine, nowadays, with the blessing of modern technology, we have social media, we have, the internet, so much information where you can read, you can see, you can hop into hop on online and watch the life of different physicians, okay, doing their day-to-day jobs. We didn't have that back in the day. So right now you can see and you can do it. So they can get a better understanding of what they're getting themselves into. So my advice to them is first, okay, read, okay, and get more information. Ask. We're all available, okay, in order to, help. And then choose something that matches your lifestyle. That's really important. I think right now it's really important to balance it out. So before you want to, study medicine and get yourself in surgery, know what you're really getting yourself to. Your time is not yours, okay? There are going to be a lot of sacrifices, a lot. So
I think that's really good advice, especially how your time isn't yours and to try to balance things.
Absolutely.
We are going to go on a short break, but then hopefully we can figure out more of the untold story of your life.
Yes, absolutely.
So stay tuned for after the break. And we're back from that short break. So we were talking about surgery and how it took you 17 years and how difficult it is, but how it really lit that flame of excitement and passion for you. And you were talking about how the first time you went through a surgical operation as, I guess, an attendant or something, you realized that this was something you wanted to do. You enjoyed it. You loved the high-paced environment. But how do you handle the stress in the operating room?
I mean, stress, that's a very good question, actually. Stress will come, okay?
True.
But I guess with good training, okay, you can limit that stress. Half of the stress comes from dealing with unknown circumstances. And in our job, you're always dealing with stressful environment. But if you train very well, you know how to handle it very well. So to the untrained person, yeah, a patient might be crashing, okay, God forbid, dying, not doing very well. But if you get trained in a certain way to know what to do in what situation. And because you're practicing this and you're doing it every single day, it becomes second nature. That's one thing. The second thing is having a good plan and a good team to help you out with it. That definitely limits how much stress you take on yourself, okay? And third thing is you have to de-stress outside work, right? So I think that's a very important component in order to recharge and go again and do it, yeah.
Yes. Let me, I want you to paint a picture of you operating on a patient. This is the situation that you see many times. And can you tell us about how did that affect you as a human being?
So, you know, patients come to you in their most vulnerable moment, okay? One, nobody wants to get operated on, okay? So
True.
you have to understand that,
Yes.
okay? And the first thing, as a surgeon, I understand that. Number two, they don't know the process. We do this every day. We know how the setup is, what's going to happen now, what happens during surgery, right? What happens later on. Patients don't know this. And so it puts them under stress. Now, dealing with patients over these years, I understand that the being empathetic, okay, and you know, being open with a patient really helps out a lot. What it taught me is, you know, being a great surgeon or a good surgeon is important, but also you have to understand the patient's feelings and see how you can deal with it, okay, in order to, you know, manage their stress during that journey.
Yes.
That's number one. Number two, seeing, you know, a lot
During
of
the operation.
exactly, seeing a lot of diseases, it just makes you understand how weak we are.
Yes.
Yani, subhanallah, we, you know, the human body is as complex as it can be. Yet it's tough, okay? Yet it's very weak. Any little thing can, you know, can damage a human being, can end the
Yes.
life, can cause disease. So that really taught me that life, as it is, okay, is a very fragile thing. And that's definitely what I understand from doing my job.
Well, that's really wonderful, especially when you're talking about little small things. I mean, most of the stuff that affects us are like germs and they're microscopic.
Absolutely.
They're so
Absolutely.
tiny.
You deal with a lot of things in and out, okay? But you know, when you study the human body and see disease and what it does, you might deal with something that you don't see, a virus, okay?
Yes.
That might affect someone, okay? And some people get better, others don't. A little vessel that carries blood, okay? If it, for instance, gets damaged in a certain area at a certain time, that can mean a serious problem, okay, to a person's health. It might end their life. So as much as we think we are strong, we're very weak at the same time.
Yeah, that does make a lot of sense.
Yeah,
Yes.
absolutely.
When you said it might end their life. So are you 100% truthful with your patient as if can you tell them what you expect of the outcome?
Yes.
Is it going to be?
Yes, very good question, Saad. So honesty is very important with the patient, okay?
Even if it's negative.
Even if it's negative, you cannot sugarcoat everything, okay? It's very important. I do this myself and I teach it to my residents and students. Always be truthful to the patient.
Yeah.
Tell them what their disease is, tell them what options they have, and tell them what is the success and failure rate. Even if you're the best surgeon in the world, complications do happen. Complications do happen, okay? That are out of your control, okay? That you have nothing to do and to do with. You do a perfect operation, but something happens, that complication, and I think patients should know what they're going ahead with. And I always say, when the benefits outweigh the risk, then it's a good treatment option.
So how does it feel whenever a complication occurs, though? How do you deal with it?
As not only surgeons, physicians, okay, all physicians take pride in taking care of their patients, right? So whenever a complication happens, we know that most of the complications, they happen with no clear cause. Some of them might have a cause. And as a physician, you tend to always, you always tend to want to blame yourself, although it's not you that caused the complication. But what we do right now is we actually learn from our complications. Whenever they happen, okay, we review cases, we make sure it wasn't a misdiagnosis, it wasn't a shortcoming on the surgeon or the physician's aspect, and we try to avoid it in the future. And that's the main thing to do. In order for medicine to advance, we need to know how to cope with our complications and treat them better so we limit them in the future.
Now, the psychological effect on you, doctor. So how do they prepare you for the psychological effects, especially that medical doctors, they need also psychological assessment?
Yeah, so I think it comes with training and with time.
Yes.
This doesn't come all at once.
Yeah.
From the day you enter med school to the day you graduate, you enter residency, you're sort of getting trained how to manage, okay, the stress, how to manage dealing with complications, how to manage the psychological aspect, because you're dealing with a patient, you're dealing with a family, you're dealing with the burden of blaming yourself if that happens. So I think it just comes with time, okay? And it comes with experience and just gets better as time goes on.
Yeah, I actually want to ask you, this is more of like a side question.
Yeah.
I personally don't have any doctors in my family or anybody like that. So the only experience I have with surgeons or medical people are from watching medical shows.
Yeah.
All those residency shows and other shows where people are trying hard to be a surgeon. Is it like that, or is that more myth than reality?
No, it's actually a really good question. Before med school, I used to watch a show called ER, and that was the only one in the late 90s, okay? It's
George Clooney,
George Clooney, exactly. And that was probably one of the closest things back in the day to what a hospital setting is.
Really?
And then came Grey's Anatomy and trashed that, okay?
Yeah, because when I think of that, it's a very different kind of...
A lot of spiced up drama, to be honest, okay? But the medical part to the untrained, okay, or to the non-medical, it's actually close, okay? I'm not talking about the drama, what happens. Now, sometimes we might say, no, this is not how you treat this. This is not how you treat that. Of course, as doctors, you always pinpoint. But to be honest, how it has some form of truth to how the setting is, how we run things, how the day-to-day life, the problems, the psychological aspect. I mean, so these shows, if I might take something good out of it, it will expose, people who are interested in knowing how doctors' lives run, okay, to part of reality, let's say, part of it.
I actually also have a side question, because I will revisit the psychological assessment. Well, my question is, I'm not trying to be extreme or anything, but I think surgeons need to be under the microscope. How? Because they are under pressure, stress. They can make mistakes. Of course, any other profession, you can make mistakes, not the surgeon. Do they keep an eye on surgeons around the world, like here in Kuwait, Ministry of Health?
Yes.
Do they check on you to
Absolutely.
Because you have decisions and they need to see.
Patient safety is the most important aspect that we take, and we take it very, very seriously. In Kuwait, we're very proud, okay, to follow international guidelines.
Yes.
We have our own guidelines where everything is being monitored. Now, let's say, a complication happens. There are always meetings, okay, which go over these complications to see why it happened and how we can avoid it. And if it was a malpractice or it was just a complication. If a problem would occur that it would go to a higher level of a court system, we actually have a dedicated medical committee, okay? It's called the Authority of Medical Responsibility, which is basically investigated by the court, medical professionals, doctors, in order to look into these cases. So we're very proud that the Ministry of Health has very high regulations when it comes to patient safety in all aspects.
Yes.
Honestly, that's wonderful, and it's really good and reassuring to hear, not just for us, but for the viewers as well, I'm sure. And I also want to ask you, have you ever had a patient or surgery that left a lasting mark on you, either professionally or psychologically?
Yeah, many, but one that I remember, long story short, it was probably 7 months after I came back from the States, early 2018, or maybe mid 2018. This lady comes in with, with very critical states. She comes to our hospital at 4 a.m. She has injury. I'm not gonna say the procedure that happened before, okay? But she has an injury to her internal organs.
From a car accident or something?
From not a car accident. It was actually, a plastic surgery procedure.
Like a botched surgery?
At another hospital, brought to our hospital. I ended up taking her to the OR and, performing multiple surgeries throughout her hospital stay. She remained in the hospital for a year and 3 months.
Wow.
1 year, 3 months with complications from that initial surgery. The lady literally almost died, okay? To this day, she's doing very well, okay? Managed to save her life, alhamdulillah. Went out of the hospital after a year and 3 months. Became a very good, patient of mine. She always, comes by and says hi. And I'm I know the whole family, operated on multiple members. They become your friends eventually, to be honest. There's not only a patient, you take it to the next level. So as much as she had a very difficult journey, okay, as much as she, alhamdulillah, she was blessed to make it out, okay?
Yes.
And you change a patient and they become a friend, okay? So definitely has a long-lasting memory, her journey.
Well, for sure.
And to this day, okay, I keep, saying the same story of how resilient she was, how such a good and blessed patient she was, okay, to make it out of the hospital 1 year later, over a year later.
Yes, I think these stories, especially from these professions, I think that we need to hear a lot.
Yeah.
Stories, untold stories about this, Lujain. And I think Dr. Khaleel gave us the thing about surgeons and how they struggle and they overcome their struggle.
Yeah, you really did. And I want to thank you for joining us today, because we really got to hear the untold story and the secret side of a surgeon's life and the journey that you guys take. And I think your patients are very lucky to have you as their doctor.
Thank you so much. It's been such a pleasure. Thank you for having me and allowing me to be on this show. And thank you so much.
You're most welcome, doctor. Thank you so much.
Thank you.
Yeah. And with that, we are going to go on a short break. And we're back from that short break. And I hope everyone enjoyed this medical edition of The Untold. I know that I learned a lot and I loved talking to him. He was so interesting.
Yes, unfortunately, we have a limited time with the Dr. Khaleel, but I think we will have him for our next episode to talk more about surgeons, their life, and the technology. We will see here, inshallah, in the next episode.
Me too. I love talking to him. He really showed us the world behind the scenes of the medical journey. And it was surprising to hear that some of the medical stuff is actually similar to real life.
Yes.
And I can't believe it took 17 years. That's such a long time.
Yes.
As English Lit graduates, it was a very different life for us versus him.
And for the viewers, be aware of my silly intelligence questions that I will ask Dr. Khaleel. Of course, I need to ask these questions. And I think Dr. Khaleel, he did a good job in this episode, and inshallah in the next episode we will talk more and more about surgeons.
Well, that is our job. And no question is stupid or silly if you think about it. All of them will give us the information to best represent Dr. Khaleel in his life and also allow our audience to learn more about the medical field in general. Exactly. And so I hope you guys are excited for the next episode with Dr. Khaleel. And I hope you enjoyed the episode today. So goodbye for now and see you next time.
Take care and goodbye.